Well, I believe that partial knee replacement does dramatically change patients' lives. It allows them to get back to the activities that they had been doing when they were younger, before they developed arthritis. And vast majority of our patients feel no pain, no disability, no limitations on their activity, and the recovery is so much more fast than the traditional way of doing surgery that they're seeing that fear factor go away from having knee surgery done.
I was in a lot of pain, and then if I golfed, I could not go for my walks, and so everything was really very limited for me. I couldn't stoop down, I couldn't squat, I couldn't stand for a long time.
And I tried everything. I tried the arthritis drugs, I tried swimming, I tried the series of shots, and everybody kind of looked at me and said, "Jean, when the time comes, you're going to know," and I did. The grandchildren would come down, I couldn't take them to the living desert, I couldn't swim anymore, so I talked to Dr. Volivis.
I went in and visited, and he looked at me, we talked a little bit, and I decided I had to have it done. I couldn't go on anymore with the pain.
Osteoarthritis of the knee can be painful and prevent you from enjoying the things you like to do. According to the American Academy of Orthopedic Surgeons, more than 15 million people in the United States suffer from osteoarthritis of the knee. Of these 15 million people, there is a large portion of the population diagnosed with early to mid-stage osteoarthritis, like Stephen Jaffe. Depending on where the arthritis is located in your knee, Makoplasty partial knee resurfacing may be right for you. The knee is made up of 3 compartments: the medial, lateral, and patellofemoral. Osteoarthritis typically begins in the medial compartment or on the inner side of the knee. During the early stage, you may have to limit some daily activities. You are usually able to pinpoint exactly where the pain is located simply by pointing to it. If pain persists, the physician can inject the site with a corticosteroid to reduce inflammation and manage pain, or prescribe anti-inflammatory medication. But as the disease and pain progress, these treatment options may no longer be effective. During early to mid-stage osteoarthritis, Makoplasty, a minimally invasive partial knee arthroplasty that uses robotic arm technology, could be a successful treatment option. During Makoplasty, the diseased portion of the knee joint is removed, and healthy bone stock and tissue are spared. Once the disease progresses into the patellofemoral compartment of the knee, partial resurfacing of both the medial and patellofemoral joint may be an option. Otherwise, your only surgical option may be total knee arthroplasty, during which large amounts of healthy tissue and bone must be removed along with the diseased portions, and this can result in a significantly longer recovery time following surgery. Today, there is new hope for adults living with early to mid-stage osteoarthritis. There's Makoplasty. Makoplasty is a minimally invasive procedure that's enabled by the RIO robotic arm system that assists the surgeon in achieving optimal resurfacing and placement of the implant. Each procedure begins with a pre-surgical CT scan of the patient's knee. This information is then digitally scanned into the Mako system for the surgeon to use in making a custom pre-surgical plan. This plan details every step of bone preparation, resurfacing, and implant positioning during surgery. This careful planning facilitates the most accurate positioning and precise alignment of the implant possible. During Makoplasty, the bone is minimally resurfaced, saving valuable bone stock and sparing tissue. The pinpoint precision and consistency afforded by the robotic arm system that assists the surgeon during the procedure provides a more natural feeling and functioning knee following the surgery. Because Makoplasty facilitates more precise placement of the implant and spares healthy bone and tissue, Makoplasty patients may experience a more rapid recovery and return to normal activities than with traditional knee surgery. This patient left the hospital only 72 hours after her surgery and returned to normal activities shortly thereafter.
The walking I've really missed. And I am a swimmer. I've been a swimmer for years, and I had even quit swimming because I couldn't do the whip kick anymore, and even the flutter kick hurt. So I was already in the pool today, I was already swimming, and it's the first time I've been able to move my knees without that kind of pain.
Where would I be now? Probably just sitting in a chair at home. I wouldn't be doing very much, I'll tell you that, because I had a lot of pain from the arthritis.
I was skeptical. It was a new, having a robot work with the doctor. because most of the doctors that looked at my knee prior to Dr. Vallivas, they all recommended a full knee replacement, the traditional. And I was ready to do that. And then Dr. Vallivas talked to me about this procedure, and I trusted him. And he told me, he said that if it works real well, it'll last as long as a full knee replacement. You'll keep most of your knee.
For many patients, the answer is Makoplasty, partial knee resurfacing.